Okay, great. Tamara, can we?
Yes, absolutely. Good morning or good afternoon, good evening. Welcome everyone, wherever you are in the world. Before we begin, just a few housekeeping notes. This seminar is being recorded and the recording will be shared after the event. We are also using a webinar format. This means that your camera and your microphone are turned off. If you would like to share something, you are very welcome to use the chat function at the bottom of the screen. Just please note that anything that you do put in the chat is public, but please feel free to share where you're from and how you are involved with hip health. Throughout the presentation, we do encourage you to engage with us on social media. You can see our handle there, and to use the hashtags Hip Health Day, Hip Legends, and Hip Hope Network, so we can see all of your posts. Thank you. And with that, I'll pass it to Kishore.
Right. Okay, again, as Tamara said, good morning, good afternoon, good evening, good night. And for some, it's really early in the morning. So thank you for being here. And for welcome to our virtual celebration of first ever International Hip Health Day. I'm Kishore Malpuri. I'm one of the orthopedic surgeons working at BC Children's Hospital in Vancouver. And I'm also a professor at University of British Columbia. Before I get started, I would like to acknowledge that I'm speaking to you from the unceded traditional ancestral territories of Musqueam, Squamish, Tsleil-Waututh nations. I know there are many of you joining us from across the globe. I would like to extend this acknowledgement, gratitude, respect to all communities from which you may be joining us today. On behalf of Hip Hope Network, welcome. Today, we are fortunate to have many of the world-leading researchers, clinicians, organizations, advocacy groups here to present their work on improving hip health for children globally. We will begin the session with short presentation from some of our amazing research groups and outreach organizations. Together, members of these advocacy groups from International Dysplasia Registry, Knowledge Translation Advocacy Board, we collaborated on 2 global surveys to capture experience of DDH patients and caregivers. The engagement of these advocacy groups helped recruit hundreds of patients and families from across the globe. Today's talks from organizations and advocacy groups will be followed by presentations honoring 7 hip legends who have made outstanding contributions to the world of pediatric hip health. In the audience today, we have over registration from 110 attendees from over 12 different countries. We also have over 15 speakers and joined by our research and clinical teams from the Hippie lab. The incredible engagement at this event highlights the truly global impact of your efforts. Great, thank you. Over to you, Emily.
All right, so I'd like to introduce our first speaker is Joel Sloan from the Hippie team here in Vancouver to talk about the Hip Hope Network.
Hi all and welcome. I hope everyone can hear me okay. The Hip Hope Network is so very proud to host this special event and unique gathering of members of the global hip health community. Thank you to everyone for joining and celebrating the inaugural International Hip Health Day with us. I'm especially excited to kick off this incredible lineup to briefly introduce the Hip Hope Network, what we've been up to recently, and what's next for us. The Hip Hope Network is essentially new and just getting started. It's an inclusive community of all types of hip health professionals working together with a shared vision to reduce the burdens of all types of hip conditions around the world. Our goals will be met by creating improvements in clinical care, research, and education and training. Already, we've been engaging over 100 hip health professionals from 5 continents and over 20 countries. And in recent months, the group's been coming together many times to help define foundational core principles and goals in preparation for bringing our shared vision to life. And so I'll ask for the next slide, please. As you can see, these foundations help define what the Hip Hope Network is and aspires to become. And they'll be reflected in all that we do, including today in this special gathering right now. So they're there in the center, and they're core to all the things that we aim to be in terms of these things that you can see on the outside. And there's too many to go over briefly today, but I'll call out a few key elements. So one is the inclusive community fabric itself that's going to connect our multidisciplinary colleagues worldwide, HIP interest groups, and an expanded patient registry program to help ensure coverage and representation always of all HIP conditions, including less common ones, and particularly a platform that's going to help us bring knowledge building, sharing, and education, and meaningful implementation according to local context and collectively the global community. Next slide, please. So if those are the whys and the whats, now we're into the hows, and it's where the real work starts, and it's very exciting because we're going to be bringing all these things to life. So based on that shared vision, our global collaborators have also developed a strategic framework, which you see here, and it will help guide our planning and development. We're presently engaging volunteers and leaders to build teams that will focus on each key area of our framework and build a roadmap and begin the key projects that'll bring our vision to life. So those key areas of focus include community, research, professional development, growth, and outreach as well. A key goal is for us to sustainably grow and thrive with strong connections and relationships worldwide. And it's important to say that none of this would be possible without the generous support from the Peterson Fund for Global Hip Health, as well as the I'm a Hippie Foundation. And a special heartfelt thank you from all of us goes out to those two groups. Finally, on the last slide, I invite you to all find out more and stay connected. Follow our social channels, visit our new website, hiphopnetwork.org, and share with any colleagues in hip health that might be interested. They can join our membership contact list. Thank you very much. We look forward to connecting with you and working together to reduce the burdens of hip health around the world. Thank you, Emily.
Great. Thank you, Joel. And next up, I'd like to introduce Uni Narayan to speak about the CP Hip Outcomes Project.
Thank you, Emily. First of all, let me say hello to everybody and thank you for the invitation to participate today. Kudos to Kishore and Emily and the incredible team they've put together in British Columbia Children's Hospital to take this initiative. I think it's an incredible effort, and I'm really proud to be part of this. The CP Hip Outcomes Project is an international prospective multi-center cohort study that was designed to evaluate the comparative effectiveness of different hip intervention strategies on the health-related quality of life outcomes for children with severe cerebral palsy. And we owe thanks to our funding agencies, including the AACPDM and POSNA, and for the main project to CIHR, which is like our NIH here in Canada. Next, please. This international study involves 28 centers in 10 countries. It has enrolled an inception cohort of 748 patients to date who are non-ambulant with a hip displacement of at least 30% on one side or greater, and with no history of any prior treatment to the hips. The study design is a longitudinal cohort study of 5 treatment groups: natural history, so no treatment at all, botulinum toxin injections given serially, soft tissue surgery alone, bony reconstructive surgery, and salvage surgery. And there's the opportunity to create nested trials within this observational study design. Next. CHOP1, which was funded from 2015 to this year, is funded by CIHR, has 3 aims. First, to answer the question, what is the impact of increasing hip displacement in children with severe CP on their health-related quality of life as measured by the CP Child, which is also the primary outcome measure for this project. The second, which is the primary aim of the project, is to compare the effectiveness of different strategies of hip interventions, those 5 strategies that I named, for hip displacement in children with severe CP. Once again, using the CP Child as our primary outcome measure. One of the key questions we'd like to answer is a prophylactic or proactive strategy versus early reactive strategies, which is more efficient and more effective. And aim 3 is to compare the types and rates of adverse events and complications associated with each of the treatment cohorts. Next. CHOP 2 is following the same inception cohort until skeletal maturity. We were successful last year in convincing CIHR to fund CHOP 1 for an additional 6 years to allow the cohort to reach skeletal maturity. And the aims are to measure the long-term outcomes for those different cohorts and to compare the longer-term rates of recurrence, relapse of symptoms, additional interventions, and other longer-term complications. And concurrently, aim 3 is to establish an ongoing CHOP registry, which will allow more sites from around the world to join. Next. These are the CHOP investigators. Many of you are on the call today from different countries around the world. Next. And a photograph of the early investigators meeting just prior to our successful application to CIHR for grant funding. Thank you.
Thank you very much, Uni. Next, I'd like to introduce Harry Kim to speak about the International Perthes Study Group.
Hello, good day, everyone. Thank you very much for this opportunity for us to share our vision and the purpose of the International Perthes Study Group. And I just want to also congratulate Emily, Kishore, and the UBC team for putting this first International Hip Health Day. I think it's a great achievement, and congratulations to all. So IPSG was established in 2012 through funding from POSNA, and subsequently we've had 4 fundings from POSNA, so we're grateful for that organization. So IPSG is a group of specialists and researchers with a common goal of advancing knowledge and care of patients with Perthes disease. And our primary goal is to determine what is the best way to treat patients with Perthes disease. You see, it's a large study group with over 40 plus members that spans 16 countries. And if you would like to know more about it, please visit our website listed right there, perthesdisease.org. Next slide, please. So the membership and organization is organized through the Lee Center and the coordinator at Scottish Rite. It's an international multi-center study group that uses a REDCap database, as noted, 46 active surgeon members and 9 scientific members in 16 countries. And our membership is still open to qualified centers, and we're especially looking for centers that practice non-operative management of Perthes disease. We perform our studies and plan these through our monthly executive and steering committee meetings and our annual meeting. And this is a map of where we are, mainly in North America, as well as Europe and some Asian countries right now. Next slide, please. So we have started as hypothesis-driven prospective study group, but now we also have registry. So first phase, we were interested in looking at early stage Perthes disease of patients in age 6 to 8, 8 to 11, and over 11. And we were also interested in looking at the role of perfusion MRI as a prognosticator of outcome. And then in phase 2, we're doing a prospective cohort studies on late stage study and looking at different treatments and outcomes. And then lately, we have opened up our early onset Perthes as patients less than 6 years old when they get Perthes, and patients get, or late onset Perthes, which is patients over 11 when they get Perthes. And this is in the format of registry. So we have a combination of prospective cohort studies as well as registry studies. Next slide, please. So we have now enrolled over 450 patients, and this is a major achievement given that Perthes disease is uncommon. If you compare Perthes to hip dysplasia, it's probably about 100 to 500 times less common. So you can see that having that 640 patients is really a major achievement. And that's why we need to have so many centers to enroll patients. We collect not only clinical and radiographic data, but we also collect perfusion MRI as well as patient-reported outcomes. And we do very active monitoring of our data, and our data completion rate is over 90%, which is really very good. We recently completed an adult Perthes survey of over 1,100 adult respondents who have Perthes disease as children, and we have patient-reported outcome data of these patients. We published now over 10 publications, and most of them within the last 2 years. So we have really become very active with publications. We've had 4 POSNA grants, and we also support engagement with Perthes study group, Perthes support groups, as noted here, parent support groups such as the Perthes Kids Foundation. We also have hosted annual Perthes parent conferences along with our own annual meeting. Next slide, please. So for our goals for next 5 years is to evaluate the role of perfusion MRI in predicting 2- and 5-year-old radiographic outcomes in children presenting at the early stage of Perthes, and to determine the effects of early femoral varus osteotomy on femoral head shape in 6 to 8 age group at 2- and 5-year follow-up, and to compare the effects of 6-week versus 6 months postoperative non-weight bearing following femoral varus osteotomy on the femoral head shape in 8 to 11 age group at 2- and 5-year follow-up. So these are our core studies, but we have numerous other studies that are ongoing. Next slide, please. So thank you.
Thank you very much, Harry. And we just had a little bit of problem getting our next speaker into the panelist room. So I think we'll come back to Anchor and we'll move forward in just a second. Oh, is Jeff here now? Okay.
Yeah, I'm okay.
Okay, you're great. Good, thank you, Jeff. So we have Jeff Nepple presenting for the Anchor group now.
Okay, there we go. If you can see my slides. Okay, thanks for having us. So my name is Jeff Nepple from WashU in St. Louis, presenting on behalf of the Anchor study group. Anchor is the academic network for conservational hip outcomes research. Our mission statement in Anchor is as a multi-center clinical research group investigating adolescent and adult hip disorders. We focus on improving patient care through research, education, and mentorship. There in the bottom, you see a picture of our expanding group from a couple of years ago in the list of 23 active centers in our Anchor study group currently. Our geographical distribution, we're US and Canadian based primarily at this point. So here you see the expanding list of surgeons, about 35 surgeons now across 23 institutions shown there. So Anchor's been around for a while, 2006, formed by John Closey and Michael Millis. Initial focuses on DDH and FAI with now over 3,000 patients enrolled in prospective multi-center research. Some highlights over the years: we hosted a ORF Academy sponsored symposium on FAI in 2012 that really drove some of the future research in the field. And then definitely over the last decade have had key publications in acetabular dysplasia in the skeletally mature setting as well as FAI, and then sort of built this research network, which is now Department of Defense funded for our FAI work. In the future, I think Anchor is well positioned for key mid to long-term studies in the setting of DDH with the treatment of the PAO or periacetabular osteotomy, as well as treatment of FAI. We've now moved on to additional endeavors, including a targeted randomized controlled trial of the use of hip arthroscopy in PAO surgery. That's hopefully wrapping up in 2021, headed by Paul Boulay out of Ottawa. And then we've also launched recent studies in the last year in sort of modern treatment of FAI, as well as borderline dysplasia, which is one of the big controversies in the hip preservation field. So we have exciting data that will be coming in the coming years. So Anchor has a great group of people working together that everybody certainly has played a big role in this over the years, and hopefully will really improve our understanding of the treatment of these more mature patients in the future. Thank you.
Great, thank you very much, Jeff. And then next, I'm going to be speaking to give a little bit of an update on the SLIP registry, which is the SCIFI Longitudinal International Prospective Registry. And our main purpose of this is to develop an international prospective registry of patients with slipped capital femoral epiphysis to examine the different clinical, functional, and radiographic outcomes of different treatments or different surgical techniques for this condition. Next slide, please, Marissa. So we are about 2.5 years old now as a registry group, and we're excited to see sort of the scope that we've managed to get. We now have a number of participating sites in Australia. We have a site now in Bulgaria, a number in Canada, in Denmark, Egypt, India, and a number of sites in the US that we have expanded to now. Next slide, please, Marissa. And so far as we are in our relative infancy, but we've now expanded to 28 different sites as shown, and we're continuously growing and recruiting more sites. We are now in 7 countries that span 5 continents, and we've recruited about 270 patients, and so are starting to prepare our first publication as a study group. And we've become the largest prospective outcome study on patients with slipped capital femoral epiphysis worldwide. And we're excited to see where we can take this group as we go forward. Next slide, please, Marissa. So some of the future research activities we have planned are at the start, our inaugural publication is to examine some of the differences in presenting patients across all the participating centers, in demographics, in initial treatment method of choice by the different centers and surgeons. And we can also move forward in looking into some effective comparative studies comparing outcomes of different surgical procedures. And a major goal of this group is to expand and continue to expand the global reach of the study. We really want active recruitment of centers from underrepresented regions to continue to join this group and give their valuable input into the future of SCIFI research. And long-term, we have the continued collection of long-term functional outcomes of these patients. Thanks, Marissa. Next slide. Okay, and also we'll be giving you a brief update on the International Hip Dysplasia Registry. So the purpose of this registry is to identify optimal management practices and optimize outcomes for patients across the entire spectrum of infants that are diagnosed or children that are diagnosed with developmental dysplasia of the hip. Next slide, please, Marissa. And so we've now been a registry group since 2016. So we are now just about 5 years old. We've expanded our reach of participating sites to now have representation from centers in Australia, Brazil, Canada, China, India, the UK, the US, and we just have a new site joining us from Malaysia, from the University of Malaya in Kuala Lumpur. So it's exciting times for our expansion, and we're continuing to, again, expand and try to get representation as globally as possible. Next slide, please, Marissa. So far, as I mentioned, we've expanded to 27 sites, and we're still growing in this way too. 7 countries and 5 continents are represented in our sites. And a big milestone we're just about to hit is we are just about at recruitment of 4,000 patients. And still continuing to grow every day. As a study group, we've had 16 publications, and we've had over 30 conference presentations at POSNA, at COSICon, COA, and around the globe. Some of the work we're really excited about is we've started working with specific groups to develop region-specific care pathways for developmental dysplasia of the hip. Specifically, we've made a lot of headway in that regard, working with a a dedicated group from India to develop India-specific DDH care pathways. We've also used our IHDR as a model for a number of our other global research initiatives. So the SLIP registry was a lot of modeled off of this registry, as well as a number of future global research initiatives that we're growing and hoping to bring shortly to you. Great, next slide, please, Marissa. And in terms of future research activities, we're really excited to be embarking on this next stage of sort of the development of IHDR as a registry. And we're working towards performing targeted randomized control trials where we can ask specific questions and compare outcomes across all of our centers. Firstly, we're embarking, our first RCT we're embarking on is a brace versus observation randomized control trial. And we also have several other questions we can start to ask in this regard with the volume of patients and centers we now have. We also are looking to continue expansion of our care pathway work. We've completed the phase 2 of development of the pathway in India, as I mentioned, and we're starting these steps in China, Pakistan, Honduras, Ecuador, Saudi Arabia, and hopefully more as we move forward too. And again, we'll also have as our long-term goal, the continued collection of functional outcomes to really understand and optimize the quality of life and outcomes for patients with DDH. Thank you. All right, and next we're gonna play a video from Sarah Toomey, who's representing Healthy Hips Australia.
Hi, it's Sarah from Healthy Hips Australia. So Healthy Hips Australia has been running now since 2015, inspired by the experience I had with both my 2 girls who were diagnosed with hip dysplasia. And I found that even though I was an occupational therapist, I was still really overwhelmed and uninformed by the condition, and felt that, you know, managing with the day-to-day treatment was really hard. So fast forward 6 and a bit years later, and Healthy Hips Australia now run national awareness weeks and fundraising days here in Australia. We contribute where we can to research initiatives and connecting people in our community who've been impacted by the condition to researchers who really make that difference in terms of how the pathway works for people from diagnosis, treatment, through surveillance and follow-up out the other side, and looking to hopefully decrease the impact that the condition has on both the child or the adult living with the condition, as well as the family and health professionals who work around them. So we have a bunch of resources on our website which really target families and trying to help them to manage the day-to-day. Lots of awareness resources as well, particularly on our social platforms. And like I said, being able to connecting internationally with the hip dysplasia and the community around the world makes a huge difference to what I think was probably not a lot of awareness a decade ago to where we are now. Still a long way to go, but initiatives such as this one with the International Hip Health Day are going to make a huge difference going forward. Thank you so much again for the recognition. Please drop me a line anytime, and I hope that everyone continues to be inspired and passionate like I am about making a change. Thanks so much. Bye.
And thank you very much to Sarah for sending in that video. Next, we're going to introduce, we have John Carney to talk about the International Hip Dysplasia Institute.
Hi, thanks for having us here today. I'm speaking on behalf of Dr. Chad Price, who doesn't like to talk about himself, but I do, and I've known him for 15 years, so here we go. In 2008, comedian Larry the Cable Guy, Dan Whitney, and his wife brought their child to Dr. Price because their child had hip dysplasia, and physicians in Nebraska were having trouble with this particular case. Dr. Price was able to basically fix their child without surgery. while they were very happy with that, they had some questions. One was, why is there virtually no education online outside of dogs? Of course, a redneck comedian was laughing at that pretty big time. Why are there no global standards of care and treatment that we can tell? And can you change this? So Dr. Price answered the Whitneys and told them that even though this is a very common and disabling condition, meaningful change for hip dysplasia would be tough because the funding that you typically look for would be tough. There's no pharmaceutical research dollars. There are no expensive implants to go to the implant companies. And quite frankly, it's not a life-threatening condition. So Dr. Price told Dan and Kara that if they wanted to do something like this and answer these questions, they would have to come in large, and come in large they did. They made a $5 million commitment to start the International Hip Dysplasia Institute. And when they did that, that's when it was born. We continue today, 13, 14 years later, with donations from all around the world, including 97 individual gifts this calendar year. Important to point out that from the very beginning, Dr. Price has insisted to me, who's an administrator, and I push back, but I agree with him. Arnold Palmer Hospital, our employer, needs to stay in the background. This really needs to be an agnostic group that all institutions can participate freely without losing their identities. Next slide, please. This is a slide of the first meeting of the IHDI, International Hip Dysplasia Institute, where a handful of leaders from around the world were brought together to formulate a plan. Dr. Price likes to circle me there in that picture. That was me, a young lad, 14 years ago. But this was in the early days when medical records with large volumes of data were difficult to manage. The woman in the front was a data manager, and she did a good job in the beginning, but it became pretty overwhelming pretty quickly. And I'll get to that in a minute. But what this group did early on, they published dozens of influential research studies, standardized Pavlik-Harnack use, completed the largest prospective study of dislocated hips at the time. And I think maybe most importantly, and even today, we influence swaddling practices and infant carrier designs for safe hips for companies around the world. We have given out seed grants that have generated an additional $8 million in NHS and other national grants. As far as the website goes with information to the world, we have accomplished that. We actually just launched our second site, but we receive over 1 million visitors per year to that site that are looking for education. We have sections for families, sections for physicians, etc. Next slide, please. So going back to the data management, when it became obvious we couldn't do it ourselves, Dr. Kishore, Malpuri, and Dr. Emily Schaefer, and the experts at BC Children's stepped up and took over the registry, and that was awesome for us. Build a new collaboration. IHDI has been able to provide some financial support, but Dr. Malpuri and I'm a Hippie have vastly increased that amount a lot since then. I have to say, Dr. Price has told me many times how impressed he is at the amazing work that Dr. Malpuri and his team are doing. It goes far beyond anything we could have accomplished, and we're truly grateful for this group. Next slide, please. So what's the future for IHDI? Two primary goals. One is to maintain and encourage communication, advocacy, education, and prevention through our website and online community. We have Natalie Caro now, who's our new rock star office manager and oversees our website, which has a new plugin for 65 different languages, and they're actually all being used. Our second goal is technology research. Most of our research efforts have shifted to basic sciences and engineering that are different from what Dr. Malpuri and his group is doing. Our research is directed to preventative, innovative technology for easy diagnosis and brace improvements that may be able to eliminate casts and surgery up to 18 months. And last slide, please. Finally, we're just thrilled and humbled to be part of Healthy Hips Day kickoff. We thank Dr. Malpuri and his group and all of you for so many amazing efforts, keeping us all in the same boat and working together. We're extremely grateful for all of you and all of your passionate organizations. And for me personally, it's been such a collaborative, friendly group of people across the globe, and that's been refreshing and just very exciting to be a part of. So thank you all very much.
Great. Thank you very much, John. So next, I'm happy to introduce Natalie Trice from the DDH UK here.
Hi, thank you so much for having us today. And I actually have a special guest this evening. So this is Lucas, and he is my younger son. So, oh, next slide, please, sorry. So Lucas will be 12 in 2 weeks, and most of his life we have dealt with DDH, something that my sister had, several cousins have, probably my grandmother had and my great-grandmother had, and it has been a roller coaster ride for the past 12 years. I went from having a toddler and a new baby to being a hospital mum and running a business, and 12 years ago, I simply didn't have the support, the help, the understanding of what to do. So there's nothing like a mother on a mission. And I started campaigning with STEPS originally. And Lucas had to have quite a lot of surgery when he was 6. He had a pelvic osteotomy. So at 6, that's obviously quite a difficult operation, time off school, and Lucas is basically the inspiration for all of the work that I have done. Next slide, please. Okay, so DDH UK was formed just over 6 years ago, and the thing that we found was that there was very little peer-to-peer support. So we're not a medical organisation, but I found that even the mums at the baby classes, no one else really understood what we were going through or what I was going through as a mother. So we set DDH UK up. Again, we work with Sarah, who you've already seen today. DDH UK, we have a vibrant, caring online community. We've got nearly 4,000 members in our closed Facebook group. Alison here today is an amazing community manager with me. And basically this is run by me and Alison. Yeah, it's a passion, and it's a love, and it's wanting no other mother to have to deal with what is a life-challenging condition, but for which we found very little support. So I've also done work with the International Hip Dysplasia Institute and the Advisory Board, Orthopaedic Research UK. I've worked with Cardiff University, and I'm also the author of Cast Life, A Parent's Guide to DDH, which Professor Clark, who was at Southampton, helped me to write with the foreword. My career background is PR, so I've also been seen across the media for the past 12 years talking about hip dysplasia, trying to make sure that it is not just a condition that people know dogs have. So quite often we do have people trying to join our Facebook group, which supports not only parents, but we have quite a lot of adults in the group who simply cannot find the support that they need. And we also have quite a request from dog owners who are trying to help their Labrador. That's always an interesting one for the admin team. Yeah, so next slide, please. This is just a tiny snapshot, because the work that we do is to essentially help those parents. I found that I would be on a ward at the middle of the night with a baby who was screaming. He'd been put into a spiker, and I didn't have anyone to talk to. So our Facebook group means that wherever you are in the world, whatever is happening, there will be someone, another member, a community manager, a volunteer who's there to help you, because we all know that children, we need the medical support, but also more than ever, parents need support, because this is extremely challenging. Next slide, please. Future plans, I mean, we're growing every day. We have more and more people growing every day. I do this alongside running 2 businesses, writing a 3rd book, having a family. So it really is a labour of love, and we run it between us, and we know that people need this. I continue to work with the media. I'm doing a lot of work on the media front so that people know where to come when they need support. Again, we don't offer medical help, but we're kind of like the hug that people need when they are struggling alone. We're looking at researching, Alison is looking at researching a new support program, a Christmas 2021 campaign, because we all know that with COVID, which is still going strong in the UK, that things are very difficult. I know that we've had good news with Lucas, his hip, thanks to RNOH and Stanmore. His hip is looking very good. He's a massive football player. He wants to play rugby in September. I'm not so keen, but we've worked really hard to get my son's hips healthy. And we want to maintain our support for other families who are still dealing with this. So yeah, thank you so much for having me and Lucas here today. And we're just so glad that something has come out of something that has been so challenging for our family. Thank you.
Thank you very much, Natalie, too, and to you both for coming on today. And I also now next would like to introduce Jonathan Ashton, who's going to talk about Miles for Hips.
Hey everyone, thanks for including us today. So Miles for Hips is an affiliate group of the International Hip Dysplasia Institute. It was developed by hip dysplasia patients who believe that as patients, we're key stakeholders and valuable members of the medical team. You can go to the next slide, please. So we're guided by the principles of participatory medicine, and we believe that patient care and outcomes will be optimized when patients partner with medical providers, researchers, policymakers, and advocates. So we sort of act as a in-between between doctors, researchers, and everybody else, just to try and make sense of the situation and explain what's going on with hip dysplasia. Next slide, please. So we're proud to be partnered with the IHDI to help support their global efforts to lead educational, research, and technological initiatives to help reduce the physical, social, and economic burden for children and adults impacted by hip dysplasia. So one of our primary goals is to provide accurate and unbiased information to patients, family, and non-experts impacted by hip dysplasia. So we try to improve awareness, early diagnosis information, education regarding treatment options, and to generally promote knowledge translation and empowerment for patients and families. So we're trying to make it so that patients and family can understand what they're hearing from the doctors, because there just isn't a wide body of research that's available out there. So we also work to provide a platform that engages those involved in the hip dysplasia communities, and we support the advocacy initiatives of all the other groups that are willing to participate with us. So next slide, please. So we have several annual activities that we do to promote hip health, hip dysplasia awareness, and to fundraise for the IHDI. So some of these activities include our Healthy Hips, Healthy Bodies, Healthy Minds Week, which we did in collaboration with Help for Hip Dysplasia and PAO Buddies. We do an annual Day of Movement and t-shirt sale. So if you guys want a Hip Love t-shirt, those are available right now, shameless plug. And we also participate heavily in the Hip Dysplasia Awareness Month activities in June each year. So we have a very passionate and talented group that is just trying to get the message out there and to engage with our followers and our volunteers who make this all possible. And last slide. So just thank you to everyone for setting this up, for involving us, and for all of the work and research that all of you are doing. It means a lot to us to be involved, and I'm sure to all the patients and people out there as well. So thank you. And that's it for me.
Wonderful. Thank you very much, Jonathan. Next, I'm excited to introduce Loredana Wyatt from the STEPS charity worldwide.
Hello, sorry, can you hear me now?
Yes.
Okay, perfect, apologies. Sorry, so my name is Loredana Wyatt, and I'm here to represent STEPS Charity Worldwide as the CEO. If we could go to the next slide, please. Thank you. Why STEPS? So for those of you that are familiar with STEPS, STEPS was founded by Sue Banton 40 years ago. Sue Banton's son was born with clubfoot, and at the time in the United Kingdom, the Ponseti method, for those of you that are familiar with the method, was not widely introduced within the national health system, within the NHS, and therefore Sylvanton created a parents group, and from that the charity grew and grew and grew, and now we cover not only clubfoot. So if we can go to the next slide, please. So the condition that we support at this point in time, and not just in the UK, worldwide, is obviously clubfoot, hip dysplasia, fibular hemimelia, tibial hemimelia, PFFD, SUFE, Perthes. From this year, as unfortunately the association in the UK has ceased to exist, so we picked that up. SUFE, Perthes, Coxa-Vara, metatarsus adductus, congenital vertical talus, and also raising awareness of vitamin D deficiency. Next slide, please. So how do we support families and individuals? Obviously with COVID, the way that we operate had to change, and everything now is pretty much online. We also operate from home, which had to reduce costs tremendously. We have a helpline, family contact service, peer-to-peer contact. We have family days, and new from this year, we have the step-in camps, which is they're technically European camps for children with lower limb conditions. But with COVID, I think they're just going to be restricted to UK. And we also give grants for medical equipment. Most of our resources now are online. We have a YouTube channel, and UK, well, Europe, we also distribute our family guides. Can we go to the next slide, please? So our guides are for parents, obviously, at the point of diagnosis, so whether it's antenatally or whether it's an ultrasound, and we distribute them for free, mainly in the United Kingdom, so to all NHS hospitals, but we also have requests in other countries where obviously English is the primary language. We are moving away gradually from the publications because we feel that parents now, they prefer to have short videos to explain the conditions and how to address certain concerns that they have. Could we move to the next slide, please? Thank you very much. We do obviously a lot of awareness. Sometimes, you know, we are referred to as STEPS UK. We're not STEPS UK, we're STEPS Charity Worldwide. We were created in the United Kingdom, but we support families and individuals everywhere. Obviously, we were a parents group. We're still a parents group predominantly in the UK, but as I'm going to show you later in the next slide, we also are implementers. So we do go to countries and implement care pathways where there's a need. The awareness, we have many, because obviously we have many conditions that we cover and do throughout the year. We have great ambassadors, many Paralympians, and historically we used to have, for those of you that remember, Dudley Moore, who was born with clubfoot, unfortunately passed away. If we could move to the next slide, please. Thank you. So there's a lot of research and collaboration, obviously, that goes on. Mainly research starts in the United Kingdom. And at this point in time, obviously, because there's the restriction for us to travel, we mainly work with local UK universities. We're obviously are part of the advisory group of the newborn and infant physical examination in England, obviously providing advice. And we just had, well, not us, but Public England just released the new standards for hip dysplasia that obviously we're supporting in training, in helping to train health professionals to understand them better. Next slide, please. So as I said before, we're not just advocacy. We are where we feel there's a gap. Where there's a gap in a country, we act as parents group where we feel that the national health system is strong and needs probably to represent parents and have that feedback to the national health system or directly to the government. In other countries, obviously, we're implementers. We at the moment have 2 pilot projects, one in Mongolia and one in Romania, understanding how to implement the pathways, translating the material in local languages, and obviously having trained orthopedic consultants from the United Kingdom going to train them. Next slide, please. So if anyone obviously is aware of people, individual parents that need our support, please, these are the contact details. As I said, we're not just advisory group or parents group, but also implement where there's a need or where we feel that there's a gap. Thank you.
Great. Thank you very much, Loredana. And I think now we are going to play a video from Bridget and Kyle Watts on behalf of Spica Life.
Hello, I'm Kyle.
I'm Bridget Watts.
And we operate Spica Life. Today we wanted to talk to you about our website.
We started Spica Life when our daughter was around 4 months old and she was diagnosed with hip dysplasia. And she went through a series of hip dysplasia treatments and ended up in a spica cast for 18 weeks. And during which we just learned a lot about taking care of a baby with a spica cast on. And we decided to create Spica Life to make those resources available to other parents going through it and build community and just be able to share our tips and really just collaborate with other spica parents too.
So Spica Life started off as mainly a resource for folks with babies in a spica cast. That's what our experience was and what we were able to take videos of and pictures of and those sorts of things. Most of the parents reaching out to us, that was their experience as well, but we started getting a lot of inquiries from people with kids in a spica cast too, and honestly weren't really able to help them very much. So one of the things that we've recently done with Spica Life is create a whole new section on Spica Kids, and it was pretty neat because a lot of parents sent us a lot of photos of their kids in spica casts, and like we said on the website, a picture's kind of worth 1,000 words, and all of those photos just by themselves really, I think, provide a lot of insight into what that kind of looks like and some ideas for things to do with your kids or you know, different things to purchase or whatever that can help you along that journey. But also just through that, we sent out questionnaires to a lot of parents. They wrote us back, and from all of that information, we were able to make a whole new section on the website there.
So one of our newest developments on Spica Life is we created a Spica Life store, and we designed some t-shirts, onesies. We have stroller tags that say "Just Fixing My Hips," so parents can put that on the stroller and try to avoid some of the "what happened to your baby" questions, and really just trying to, again, build that sense of community through the shirts we wear, awareness of hip dysplasia, and just kind of the sense of parents knowing they're not alone going through a spica journey.
Other than that, probably the biggest thing that we still just try to do is just be there for families. You know, pretty routinely we'll have folks reach out to us through social media or through our contact page on the website, whether it's just thanking us for having Spica Life available to them, or a lot of times asking questions, and if, you know, whatever question they have isn't something that we can answer based on our own experience, we were able to point them to a lot of different resources that are out there now where they can get their questions answered.
Thanks for watching.
Please check out our website and reach out if you have any questions.
Wonderful. Thank you, Bridget and Kyle. And finally, for our advocacy groups, I'd like to introduce Regina Wilkins speaking about I'm a Hippie.
Thanks, Emily. Hopper and I, our Hippie frog, would like to say thank you for having us here. We are really honored to be a part of the first International Hip Health Day. And before anything, I'd like to congratulate the Hip Hope Network team for putting together this milestone inaugural event. Next slide, please. So we at I'm a Hippie have been so privileged to be able to work with the best of the best in supporting the work of Dr. Malpuri and his team at BC Children's Hospital. We have, by osmosis, also made it our own personal mantra that no child should suffer the burden of hip dysplasia and other hip disorders. Next slide, please. To this goal, our focus has always been, first, to raise awareness for pediatric hip conditions and the importance of early detection. Two, to raise funds to support research, education, and innovation initiatives. Some examples would be the International Hip Dysplasia Registry, public health campaigns to educate new families on safe swaddling and about the importance of their baby's hip health. And we've funded the development of the world's first washable brace in collaboration with UBC's engineers and scrubs. Third is, and most importantly, we think, is to build community. Hippies like ourselves, passionate about children's hip health. Next slide, please. For our patients and families, we've created the Hippie Community Forum, so they have a safe place to connect with others who share their journey. Most recently, we created the Hippie Family Assistance Fund to help families who encounter financial challenges due to unforeseen expenses stemming from a hip disorder diagnosis. Next slide, please. Raising funds and building community often go hand in hand. For example, we are this weekend, as we speak, just winding down our first ever Leap into Action Move-a-thon for Kids Hip Health in celebration of International Hip International Hip Health Day. My notes say that I'm so excited to share we are on track to double our fundraising goal, but actually, as we speak, we have exceeded doubling our fundraising goal. And in that regard, I think in terms of fundraising and community building, this event has been a really, really big win. The level of engagement and participation we got from the community is far beyond what we had ever imagined. So we are so grateful to our Hippie community. Another event we are excited about is our annual Fundraiser Gala, where we raise most of our funds, but also have the opportunity to bring a lot of our Hippie community together in one room. Our last gala in 2019 drew about 500 people who helped us raise just over $450,000. But like all organizations, last year we were sadly not able to have our event due to COVID, but we are cautiously optimistic that with the changing guidelines, we might be able to look forward to an in-person event again this year. It's a really big thing for us to be able to have this gala. It helps us support a lot of the initiatives. And so we're very excited for that to happen. Here in Vancouver, we are powered by a strong community of volunteers, doctors, nurses, researchers, patients, and families who inspire us every day to do what we can to reduce the burden of a hip disorder diagnosis. But at Hippie, we believe that our community knows no borders. Our work here must impact children, not just here in BC, but also children around the globe. So we stand shoulder to shoulder with other organizations from different parts of the world who, like us, work tirelessly to improve the quality of life in children suffering from a variety of hip disorders. I believe, well, we've seen most of them here today. Organizations like STEPS Worldwide, Miles for Hips, Spike Alive, and of course, International Hip Dysplasia Institute's Dr. Charles Price, DDH UK's Natalie Trice, and Healthy Hips Australia's Sarah Toomey. Congratulations on being honored as Hip Legends. We took a page out of your books. Your work in raising awareness and your advocacy for hip dysplasia have always been an inspiration to us at Hippie. And to all our other Hip Legends, a huge congratulations and thank you for leading the way. I believe we are all here for one reason, and that is so that everyone, adult or child, can have the best quality of hip health care, no matter their circumstance, regardless of means, and no matter where they are in the world. Coming together on International Hip Health Day is such a monumental stride towards making this a reality. Thank you so much. Oh, next slide for our information. Nick, thank you so much again for having us here. If we have questions, please reach out. We're always happy to collaborate, always happy to help where we can. And once again, a big congratulations to the Hip Hope Network team for putting this together, and thank you very much for having us.
Great, thank you, Regina. I'll hand it over to Kishore now to transition to the next part of our program.
Okay, so thank you all for amazing presentations and inspiring. And I think I want to echo what Regina said. You know, for me, I'm inspired by many of these hip legends. So we thought there is no better way than to learn from, and, you know, standing on these shoulders of these giants is where we are able to see far. It's a great way to start this tradition to recognize several people around the world. And since it's our inaugural day, we managed to just get some nominations from people that have nominated these extraordinary people, as you will see. Several of them, I've had a good fortune to directly work with them and learn from them, and they have been my mentors. And there are some, when I was training during my days, I never even imagined that I would meet them one day. And to give you an example, either Dr. Price or Dr. Herring, I've read their books, I've read their chapters, and I had to pinch myself the first time I met both of them at Posna. That was actually real, that I was meeting these people. So it's an incredible privilege today to honor these hip legends. And before we move on to this, I just want to take one opportunity to stop the presentation for all of the panelists to turn on their cameras so we can take a picture of all the panelists that are here to mark the International Health Day. So Marissa, if you could stop the presentation, if we could have everybody to turn on their camera. Great. That is awesome. And Tamara, can you take some screenshots for us? That's great. Are we good, Tamara? Good, thank you. So we can go on to a presentation, please.
Great, thank you, Kishore. And so first up, once we get the slides back up, I'd like to introduce Pablo Castaneda to present the award, the Hip Legend Award to Dr. Charles Price.
Thank you, Emily and Kishore. I think you two are hip legends in your own right. And thank you for putting together all of this. It's an incredible amount of work and you should be recognized for it as well. But it is my distinct pleasure to be able to introduce Chad Price today. I have to say that when Kishore first reached out to me and asked me to do this in less than 3 minutes, I felt it was a bit of an overwhelming task. It's impossible to do this and recognize the many accomplishments Chad has had. I've come to know Chad quite well, and his humble disposition makes it even more challenging because he always puts others before himself, as John alluded to, and it makes it even harder to come up with things to say nice about him. I first met him when I was a fellow, and we shared the same alma mater, Baylor College of Medicine. I gave a fellow level talk on leg calvé perthes, and I'm sure he doesn't even remember this. Still, he paid me the highest compliment he could have done when at the end, he simply said, you know, I cannot disagree with you, and I'd really like to. If I just listed Chad's accolades, it would take me far longer than the 3 minutes that I have for this. And one of the things I found in him is this habit of reflecting the light off of himself and onto others. His contributions to orthopedic literature are wide-ranging. He's an authority on scoliosis and an unassuming pillar of modern-day joint preservation surgery. It was way back in 1978 that he wrote a paper which was published in the JBJS titled Ligament Repair in the Knee with Preservation of the Meniscus. And this, remember, is back in the time when meniscectomy was the standard treatment for all meniscal injuries. But it's this kind of insightful research that has led Chad to be a true pioneer in orthopedic surgery. He spent his career, as you all know, in Orlando. He's the past president of the Pediatric Orthopedic Society of North America. He's chaired the American Academy of Orthopedic Surgeons program. And as we heard from John as well, he founded and ran the International Pediatric Orthopedic Symposium for over 10 years. If you can go to the next slide. He's come into his own after founding the International Hip Dysplasia Institute, established in 2008 after this almost serendipitous meeting with Larry the cable guy, spotted there in the middle, and Chad sporting a very fashionable outfit for his golfing. And you heard already about the IHDI, which is this non-profit collaborative effort that is entirely Chad's accomplishment. This organization has fostered cooperation, improved education, and supported research on hip dysplasia. And to give you an example of who Chad is, when the IHDI was being formed, aside from expecting nothing but the most rigorous scientific minds to be, he insisted that everyone who was a member had to be fun. And I'm not joking, many a time I would look at the program he had put together for the meetings, and hidden in there, amongst a robust agenda, you would find a scheduled food fight. And these moments of levity would bring humanity back to what could sometimes be heated and often arid discussions. Chad is a teacher, he's a mentor, and he's a friend. And the world of hip dysplasia is far better off having Chad as a beacon shining bright for the last 40 years. I don't think it's an overstatement to say that the world would be a better place if more people were like Chad Price. So thanks very much for allowing me to honor him. And I congratulate you for putting together this outstanding program.
I have to interrupt and say thank you very much, Pablo. That was more than I deserved and greatly appreciated. And to Kishore too. It's a wonderful recognition, and just I'm delighted with the way things are going under all of your guidance. Thanks.
Thank you, Chad. Kudos to you. And certainly for me, this hip dysplasia journey wouldn't have started without you inspiring me to get involved. So I think wherever we end up in the end, I would always remember that you started me on this journey. Thank you. Over to you, Emily.
Great, thank you. And congratulations on that well-deserved honor, Dr. Price. Okay, next, I'd like to introduce Dr. Nicole Williams, who will be presenting the Hip Legend Award to Sarah Toomey.
Thank you, Emily. Well, it's a real pleasure to introduce Sarah Toomey. We heard from Sarah earlier, and she's been a real powerhouse in Australia with hip dysplasia, awareness, education, advocacy, research, and support for families with children with hip dysplasia. As we heard, she founded the charity Healthy Hips Australia, and her website and Facebook page have really become the go-to online resource here in Australia for families when they've got a new diagnosis or even an old diagnosis of hip dysplasia. We've heard she's a mum. She's got two beautiful girls herself. They were both treated for hip dysplasia, and she's also a healthcare professional. So she's in a really good position. She understands what's important in this condition, and she understands how to communicate both with the parents and also with the healthcare professionals. She had Healthy Hips Week added to our Australian calendars in April each year, when we all wear green to be seen, and she's had information on hip dysplasia and swaddling added to our early childhood healthcare books and in take-home packs from the hospitals that new parents take home with their babies. And just about every time there's a conference in general practice or a babies and parenting expo anywhere in our country, Sarah's there, and there's a Healthy Hips Australia stand, and Sarah or one of her friends are there answering questions and sharing information about hip dysplasia. So I really think that Sarah's changed the lives of many families living with hip dysplasia, and it's really wonderful to see that all of her hard work's been recognised today. Thank you on Sarah's behalf for this honour.
Thank you very much, Nicole, for presenting, and congratulations to Sarah. Okay, our next Hip Legend Award, I'd like to introduce, we have Allison Chown to present the Hip Legend Award for Natalie Trice. Allison, you're muted, I think. There we go.
Is that better?
Yes.
Yeah, good, right. So, what can I tell you about Natalie? I've only known her for about 18 months. I came across her through her book, Cast Life. I'm one of triplets who were all born with hip dysplasia, but I really knew little about it before I met Natalie. It's been a very steep learning curve with the two of us working together since then. Natalie campaigns with a fierce passion and determination alongside working full-time. And you've heard about everything she does for DDH UK. Last year, we had many plans for the charity, but COVID put paid to that. But Natalie was still raising awareness by being interviewed by the BBC and Sky News about the delays in diagnosis because of the pandemic. We launched a Food for Thought campaign to help our community members during lockdown to pay for food and school meals and things that they needed. The last year has been a struggle for Natalie and her son Lucas, but Natalie's always looked on the bright side, supporting the community members of DDH UK. She's trained to become an accredited coach, and she is still smiling despite everything that's happened. And she genuinely really cares about all our members, and she supports her son with the greatest amount of love. So thank you for allowing me to recognise Natalie for this very much well-deserved award.
Wonderful. Congratulations to Natalie, and thank you very much, Alison, for presenting. Such a nice honor. All right, so next up.
Sorry, I was just going to say that actually for me, the award is for my son, because Lucas has had the biggest, even to the point where his entire school walked a mile for healthy hips with our Paralympic swimmer patron, and my son has been through more trauma and pain than any adult I know, and yet he smiles, and he is truly the most inspirational child. So whilst I wouldn't wish hip dysplasia on anybody, he has in fact made me a much better person. So this award is actually for my son. So thank you. Yeah. Thank you. Thank you, Alison.
Thank you, Natalie, and congratulations, and to Lucas as well. All right, next up we have Kishore Malpuri will be presenting the Hip Legend Award to Dr. Jian Yang.
Yeah, I've had the good fortune of meeting Professor Yang actually at one of the IHDI meetings and at Posner meeting. Professor Yang spent some time in North America doing his fellowships, went back and started as working in the Tianjin University, and subsequently became chief and became a force to be reckoned with in China in terms of pediatric orthopedics. For a number of years, he's been the head or the convener or the chair of Chinese pediatric orthopedic group. And I was invited to visit Tianjin. It was great to see a city like that through systematic screening is eliminated late presenting DDH in their region. They still get a lot of walking age dysplasia from other parts to come to treatment. And the research contributions that he's made and the unit he's built and the influence he's had on the pediatric hip world led to a dedicated pediatric hip meeting that Dr. Schumann leads from Beijing, that both myself and Pablo were in the last meeting they've had in 2019, and several on this panel have actually visited Dr. Yang and as well as Schumann Lee. So it's incredible honor for me to recognize Dr. Yang as an inaugural hip legend for the amazing amount of work that he's done in China and his hard work to connect China with all of the language barriers with the rest of the world and get us closer to the amazing amount of work. This meeting that I was at really opened my eyes. We were thinking about bringing all of the pediatric hip health under one umbrella with pediatric, Hip Hope Network, Hip Health Outcomes in Pediatrics. But they've been running that meeting for about 4 years where they have a 3-day dedicated meeting just focused on pediatric care. And the effort they've taken to organize that. And there were over 350 participants from all over China that come to that meeting. So it's really an eye-opener for me, those that practice in the English-speaking world, that there is incredible amount of high-quality work that happens in these countries. And we have a lot to learn. When I visited Dr. Schumann's hospital in Beijing, I was pleasantly surprised the amount of surgery they were doing on pediatric hip, 9 consecutive operating rooms running every day. That's probably would take my trainees to be exposed probably about 3 months to the same quality of exposure to the volume of surgery and the quality of surgery. So it's my distinct honor to recognize and to present to you inaugural hip legend, Professor Yang.
Thank you, Kishore. I don't know, I think we had Dr. Yang on the call earlier, but I don't see him. So we will move back to you, Kishore, to introduce the next hip legend to Dr. Benjamin Joseph.
Dr. Benjamin Joseph is my mentor and really the person that inspired me to be a pediatric orthopedic surgeon. And he has had many, many contributions really over the years, but the most notably, him and Dr. Ashok Johar in India, really, I would say, the pillars that gave birth to Pediatric Orthopedic Society of India, and really that transformed the society today to say between the second or the third largest English-speaking pediatric orthopedic meeting in the world between EPOS and POSI. And his contributions really span across very many different pediatric orthopedic conditions. His practice really spans across a lot of complicated, complex pediatric orthopedic conditions. But world would recognize him for his contributions to Perthes disease. And so are the next 2 legends that are being recognized. When I was growing up, as a pediatric orthopedic surgeon, it is the work of these 3 legends that I've read, I try to understand and I try to follow. So it's fitting that Dr. Joseph is recognized along with Professor Caderol and Professor Herring as an inaugural hip legend. And he is still very active in writing books, book chapters, and working on research, mentoring many others. We here in Vancouver are very lucky at BC Children's Hospital. He is accepted and continues to be a mentor for our research program. So Dr. Joseph couldn't be here. As you can imagine, it is 1:30 or probably 2:30 a.m. his time in India, but he sends his wishes to everyone and he sends his congratulations to the other hip legends that are being recognized. So I present to you our inaugural hip legend, Professor Benjamin Joseph from India.
Congratulations to Dr. Joseph, and thank you, Kishore. So moving on to our next award, we are going to have Dr. Deborah Eastwood presenting the Hip Legend Award to Dr. Anthony Caderol.
Thank you. I'm hoping to just show you literally one slide. So. So like my other panelists here, how do I begin to describe the legend that is my Tony as distinct from the Scottish Rite Tony? How do I spend just 2 or 3 minutes telling you about the influence that Tony Caderol has had on the patients from the UK, his consultant colleagues, and the many trainees who've passed through his hands, so to speak? I have the great privilege of working in the Caderol unit. I also had the great privilege of working with Tony for many years. It was an honor to be asked to join him at Stanmore Hospital. And then what he did to me is what I'm going to tell you about. I had the little bit of the arrogance of youth. I thought I knew a thing or two, and I must have known a thing or two because he'd asked me to join him. But it took no time at all for him to make me realize in a very gentle way that actually I knew nothing, because I'd made that great mistake that too many people do of just reading a book, taking the fact and thinking that's all there was to it. So Tony Caderol taught me that it takes time to understand the patient and their pathology. And if you don't listen and learn from every patient and question everything they say to try and help your understanding of the pathology, if you don't look at the similarities and the differences between patients, then you are never going to understand the problem that they are presenting. And if you don't understand the problem and the pathology, then how on earth can you help them? His great mantra to me was that treatment should alter the natural history, which means that you should know the natural history, which means you listen and learn from all your patients. He also taught me that the treatment should alter the natural history for the better and not just make things different. And that has been a real advocacy for critiquing the work you do, critiquing the literature, making sure that you ask, is that right? Is that reasonable? Is that the correct thing to do? He taught us the similarities and differences between DDH, between a slipped epiphysis and that conundrum that is Perthes disease. And again, judging with the theme of keeping an eye on things as people grew up and the process of growth and the influence of growth on the natural history. As everyone was splitting pediatrics away from adults, he said it was important to have a young adult hip unit where you can make sure that the lessons of the past inform the decisions of the future. So we are still proud to have the young adult hip unit at Stanmore. And we also have what we call the grown-up kids clinic too. So they're similar but different beasts for the different sorts of pathology that might find their way into that clinic. But what else has he taught me? Well, he's taught me that enthusiasm is everything. He's taught me how to make my mark. So whilst he was teaching me my clinical skills, he also taught me leadership and advocacy and managerial bits of information too. So for everything that Tony has done for me, and therefore by default to all the patients, the colleagues and the trainees, I thank you, Tony. And of course, your partner through most of this, Jill, who is sorely missed by us all. So thank you, Tony. You are a legend to me. You are a legend to many people. And it is a privilege and a pleasure to give you this honor on behalf of the Hip Health Day. Thank you.
Wonderful. Thank you very much, Deborah. And congratulations to Dr. Caderol. Thank you for joining us on the call today as well. If you're there, I'd like to say a quick hello. Possibly on mute. All right. So moving on to our final Hip Legend Award, I'd like to introduce Dr. Harry Kim, who's going to present the Hip Legend Award to Dr. Tony Herring.
Well, my name is Harry Kim. I'm at Dallas, Sky's Right for Children, and thank you for saving the best for the last. So Dr. Herring, and I usually call him Tony, but I'm going to use Dr. Herring just to show my reverence for him and my respect, because he's really the chief of chiefs and the captain of captains. And if you ever visit Sequoia National Park, you will recognize he's that tree, the General Sherman, who was noted for his contribution to the Union Army that won the American Civil War. So I've gotten to know Tony now 12 years, and we had a kind of unusual interview process when I was being recruited. Normally you sit around the office and you talk about what you want to do and what you're going to do. Rather, Tony is really a personable person who really wants to know you and who wants to sort of, not just you, but your family and your children. And along those 12 years, when we ever have conversation, it's always about me. He's asking about how I'm doing, how my family's doing, and how my children are doing. So this is a giant who is not concerned about accomplishments. He's really concerned about people who work with him, people he trained. And you can see that, and I I didn't train with Tony, but I could testify, and that's what makes Scottish Rite very special. He really builds that family-oriented culture. So thank you, Tony. I just want to outline some of his accomplishments. There are many. His CV is hundreds of pages, publications, probably well over 150. And I've had pleasure of working with Dr. Salter, Dr. Rang, and some of the real giants, of the time. But really, Tony is the gentle, kind giant who gives his time and his energy to others. And so, like some others have mentioned, that he really is a servant leader who cares more about you and who brings out the best. In terms of his legendary accomplishment, he was only the third chief of Scottish Rite, and I'm wearing the shirt that celebrates 100-year anniversary of Scottish Rite, and he was the chief for 35 years. So you can imagine he's had a profound effect on Scottish Rite and also pediatric orthopedics, as the Scottish Rite has become the center of excellence, patient care, training, and research for pediatric orthopedic care. And as you know, he started the fellowship program, which has trained now over 190 fellows, and many of them have gone on to become the leaders and the chiefs of their centers in US and around the world. The other major impact he's had for the education of pediatric orthopedics is he took on that monumental task of becoming the editor for Tadgens when there's really was a vacancy in terms of who would continue on with this monumental effort. And he has really rounded us up, the staff at Scottish Rite, to contribute and edited 4 editions of Tadgens over the last, I think, 15 or 20 years or so. The other accomplishment, if you look at Perthes disease alone, he was really a visionary because he started the original Perthes study group in the 80s when people weren't thinking of prospective studies. And people didn't have the computers and the internet to do these kind of studies, where he brought people together and he developed relationship and was able to complete that study, which was published, and it's a landmark paper on the outcomes of the non-operative and operative treatment for Perthes disease. The other major contribution he had was the development of the lateral pillar classification that we all know of. I've looked at the literature, and there's been over, I think, 500 citations, meaning 500 papers have cited his work. And it really has had profound influence on how we prognosticate and manage patients with Perthes disease. Finally, I just want to reiterate that he's truly a giant in the field of pediatric orthopedics, but he's humble and gentle man. And I don't think I could say anything higher than he's really a great mentor for me, and not just for me, but for so many other people, and have been really the inspiration and have really made us to bring out the best inside of us to care for our patient and to do what is best for our pediatric orthopedics. So thank you very much, and congratulations, Tony, for this well-deserved recognition.
I'd like to reply if I could. First of all, thank you, Harry, for that wonderful introduction. And Harry and I have a great relationship in which we argue continuously, and it's a very healthy sort of thing. We all want to get down to the real evidence and see what it is. I want to especially congratulate Kishore. I think this is a wonderful organization that you've created, and it's so nice to see it taking off as beautifully as it is. I'd also like to mention, I think Tony Caderol really turned the tide about Perthes, in that prior to Tony, I think Perthes was treated as sort of a uniform disease. And he brought out the fact that about half the patients do well without treatment. And I think that broke the cycle of locking kids down in hospitals and various things that were going on, and gave us a path to sort of understand the disease so much better and to refine our understanding. And I think Harry is really the future of Perthes in our place, and I think he's going to be a wonderful leader throughout. Finally, I had never been called a legend, so I looked it up to see what it says the definition of a legend is, and it says it's something or someone about whom people know a lot, and most of what they know about them is not true. So there we have it.
Well, Tony, as you would always have, you have to end with a great humor. So thank you. But you know, I mean, you are a legend in a true sense, where we stand on your shoulders to look as far ahead as we can. And thank you for all your contributions. Great. So I'd like to wrap up now to thanking all of the presenters, and thanks to everyone who took time to join us today in celebration of this inaugural International Hip Health Day. We're grateful to showcase all of the amazing work taking place to improve hip health across the globe, and look forward to continued collaborations with all of you. We're in this together. And one of the things that I would like to see is, as you can see, the advocacy groups, even though there's considerable amount of effort from all of us to include the 90% of the world that typically is not represented in these study groups or research or advocacy groups, I know every single one is making an effort to be more globally engaging. And I think this pandemic really shows that our borders are porous. We need to be really thinking about not just in our own communities. We absolutely need to try to improve care in the communities we work in, but together, we need to work together to improve care globally. I'd like to thank some special people and special organizations that have actually funded for this Hippo network and for this to actually happen. Jane Young. Jane is on the call here, and she and the Peterson family have been truly amazing at believing in us and making a large donation last year for us to actually make this into a reality. I know I have not got permission from them to share, but there is another remarkable lady now and her family. They're actually listening to us. Imagine you getting a check in December in a snail mail. You open the check and the check is for $100,000. And then you call to tell them about what you're doing. A week later, you get another check for another $100,000. And that's Monday Family, and it's truly inspiring. And I still reflect on how somebody would send a check to support your program in a snail mail with no advance notice. And that's the kind of support we received in the pandemic. And Lil Hum, our director, who is here, and we received a large support from our foundation to continue to carry this work. And all of you that you see on the screen, but truly the foundation that gave us the belief that we can actually do it is 4 years ago when Regina Wilkins walked into my office and said, Kishore, we want to support your team's efforts to really be globally relevant. And I think I'm a hippie. There are several hippies that are around in this province and around the world. And I think it's their support that gets them going. But if you have all of that, but there's nothing that you can do without the support of our patients and families that tirelessly support. But what's so inspiring for me today, I was just watching all of the notes that are coming together. Each of these study groups and each of those advocacy groups and the legends that we have seen today, and their work is truly inspiring and inspires each other. And what we would like to do in the pediatric hip world, we do not like to have a word called competition. We'd like to build collaboration. And that's what we're seeing here today. We're all going to learn from each other. These are all distinctly different organizations, but there's so much common good that all of these are trying to accomplish. And I think in years to come, pediatric hip and this group is going to be a model for many other hip conditions to follow, where knowledge translation happens seamlessly from the generators of the knowledge and the advocacy groups that will help us amplify and translate that knowledge into our patients and families and back from them to, again, for us to do more advancements. So I'm really excited. I think this is just the beginning. Hopefully we will see much more of a global representation as we go. And this is going to be a day that we will always remember, that 30th of May, 2021 is where we started something unique, and this will continue to grow and continue to change the way pediatric hip health is delivered and improved. So no one should suffer from the burden of these hip conditions. Thank you all for joining. And you know, we're a little bit over late, 4 minutes delayed for your afternoons or mornings or whatever. But it's incredible that we've got all of these presentations and everything done on time. And a big round of applause from everyone to the tireless team. And I think there's about 10 of them from the Vancouver team that have been working nonstop for the last 3 weeks. When I told them we're going to do this day, they looked at me, they said, really, we're going to make this happen? But incredible energy from all of them to actually make this a reality. So congratulations to the team that organized all of this, several of them are here and few that are not here. Thank you. Thank you all.